If you are a cancer patient and your oncologist, after reviewing your personal and family history, advised you to get a genetic test done, that means he is suspecting some genetic error that might be leading to a cancer. These genetic errors or abnormalities are called mutations, and that can predispose you as well as your family members to increased risk of cancers. Most of the cancers does not have any specific genetic abnormality, rather it results from interplay between various environmental factors, dietary factors, as well as various other unknown factors. On the other hand, in genetic cancer syndromes or familial cancer syndromes, where there will be specific genetic mutation that can run through family from you to your offsprings, and it will be existing in your siblings or your parents, and they are all at risk of developing various cancers at various phases of life. So do we need to get these tests done for all the cancer patients? No. That will be decided by your oncologist based on your family history, personal history and tumor characteristics. Few red flag signs are: 1. If there is a particular cancer running through different generations within the family, or if there is multiple different cancers happening in different members within the family. If a same patient have two different cancers occurring simultaneously or at different point of time. A cancer that is developing at a very early age, especially breast cancer before 50 years of age. And there are certain cancers for which guidelines says you have to get genetic test done. For example, a triple negative variant of breast cancer, male breast cancer, pancreatic cancer, prostate cancer and ovarian cancer. Now, if you got the test done and the report came out to be positive, what is the significance? It has got implications both for the patient as well as for the relatives. For the patient, actually we can decide upon the treatment, and treatment decisions can be made based on this report if we have a particular drug available against this mutation that has came to be positive. And another important advantage is that we can start screening for whatever second cancer that might develop in future from the beginning itself. For example, if a patient turns out to be positive for BRCA1, BRCA2 gene, where the patient have an increased risk of breast and ovarian cancer. So if the patient has one breast cancer, during the surgery, we can actually offer them a preventive surgery by removing the opposite breast as well as ovaries so that they won't develop cancer in future. Or we can offer them a screening modality like mammography or MRI of breast as well as USG of the abdomen, ultrasound of the abdomen, screening at that time itself for early detection of the cancer. For the relatives, the same mutation should be tested in the close relatives like siblings or children or parents, and if they are also positive, we can offer them either preventive surgeries or we can also start screening for early detection of cancer. How do we test for these genetic mutations? This is usually done through a blood sample, and it's very easy process. You have to give a blood sample. Test report will be available within 3 to 4 weeks. The most important thing is that you should never get your test done by yourself. It should always be under the guidance or advice of a clinician, because many times there will be some abnormality that might come out in these tests which may not have any significance, but that might raise apprehension and concern for the patient as well as the clinician.